Good morning. I'm Janet Mentes, Professor and Director of International Programs and Scholarship at the UCLA School of Nursing. It's my pleasure to welcome you to the presentation, Creating a Multi-Country Collaborative Nursing Center for Excellence in Tobacco Control in Eastern and Central Europe, and to introduce you to our presenters. Dean Linda Sarna, Dean of the UCLA School of Nursing, and Professor Stella Bialis, University of California, San Francisco School of Nursing, are internationally recognized for their scholarly activities promoting nursing involvement in tobacco control. They developed the first national program to help nurses quit smoking in the US and to promote the role of nurses in tobacco control, inaugurating the award-winning website Tobacco Free Nurses. Their initiative, Tobacco Free Nurses, is recognized by the American Academy of Nursing as an edge runner, which recognizes nurses leading the way in healthcare. They have led translational research projects to increase interventions to treat tobacco dependence among hospitalized patients in the US, mainland China, Hong Kong, Portugal, Central and Eastern Europe, using web-based education programs and resources. They have collaborated with national and international nursing organizations on policies related to nurses and tobacco control, including the American Academy of Nursing and the American Association of Colleges of Nursing. Dean Sarna led the implementation of tobacco-free policy at UCLA as chair of the Academic Senate. Today, they will share their experiences in developing a multi-country collaborative to engage nurses in helping patients quit smoking. Welcome.
Hello, everyone. I'm so delighted to have an opportunity during International Education Week to share our international experiences. It's especially perfect that today is the Great American Smokeout, launched over 40 years ago by the American Cancer Society to celebrate people who are quitting, to provide everyone the support for at least one day to quit smoking. Because much of our work, Stella and my work, both in the United States as well as around the world, has been to help the largest group of healthcare professional nurses to help patients quit smoking. Tobacco remains the leading cause of preventable death around the world. 8 million people lose their lives every year due to tobacco, and many, many more suffer the loss of a loved one or suffer some of the comorbidities associated with tobacco. Now, facing a pandemic, COVID-19, we see that those people who are at higher risk are those people with the comorbidities such as cardiovascular disease, respiratory disease, diabetes, and all of those diseases. A risk factor is tobacco use. So today we want to take this brief time to have a conversation about what we've been able to do over our past 2 decades of collaboration at the early days of web-based education and electronic communication. And so I'm going to have Stella begin to tell a little bit about why we engaged in this particular multi-country collaborative. So Stella, we have a screen that is going to share a little bit about where we've done our work. Thank you.
Thank you, Linda, and thank you for inviting me to participate in UCLA International Education Week. It's a pleasure. As you see on the slide, we started our work with an opportunity to collaborate with colleagues in the Czech Republic. So part of doing some international work is to establish a good partnership at the country level, and we're going to talk more about that. From the Czech Republic, we expanded to include Poland, and that gave us a sense of the situation in Central and Eastern Europe. And what we found out is that the rates of tobacco use in these countries were similar to the rates from the West countries in Europe from decades before. So there was an enormous need to address some of these disparities. People that live in Central and Eastern European countries have disproportionate amounts of tobacco-related diseases, disproportionate amount of cancer. And so we figure nurses, as the largest group of healthcare professionals, will be perfectly poised if educated. And the issue was that nurses are very well positioned to address tobacco use with their patients. However, they have, most of them, not received this education during the nursing school, which is common, we found out as well with other health professional schools. So that's what we decided, that Eastern Europe was a good area where we could have a good impact, something that would be measurable by educating nurses in several of these countries that have been disproportionately affected for very high rates of tobacco use and very high rates of tobacco-related disease. And Linda will discuss a little more how we went about developing our network and of partnerships.
Thank you, Stella. One of the things that all of you know is that in order to make anything happen, it depends on relationships and it depends on people. And I can't emphasize enough how very, very important the support of Dr. Eva Kralikova in the Czech Republic, a leader in tobacco control in the world, was to what we were able to do with our nursing colleagues in all of these different countries. On this slide, you can see some of the nurses who were engaged in one of our meetings and hold a certificate, as well as some of the slides in different languages that were part of the translational effort, the huge translational effort, where we modeled our Helping Smokers Quit educational program that we had tested and validated in the United States, to then translate, revalidate, and make certain it was culturally appropriate in each of these countries. In each of these countries, they had different resources. Many of them had quit lines to support quit efforts that nurses did not know about, so we wanted to promote that. And we were about making a simple bedside intervention because we knew that the evidence would make a difference if we asked patients about their smoking status, if we encouraged them to tell them that quitting smoking was one of the most important things they could do for their own health, and that we would help them in this effort. In order to understand nursing education, it wasn't just about deficits in nursing education, it's also deficits in healthcare education in many countries around the world. And that is that many people knew about the health impact of tobacco use, but they didn't know about the evidence-based strategies, how to help people quit. So what we'd like to do for our program now is to share with you some of the barriers, some of the challenges, and some of the opportunities that we experienced when we worked with nursing champions and nursing organizations in each of these different countries. So Stella, do you want to begin? I have to say that Stella and our partnership, actually, it helped that we worked with the World Health Organization and produced a monograph about the nurse's role in non-communicable disease, where tobacco was a very, very important factor. We also have our other research programs, so we had some credibility and fortunately some networking when we came and visited the different countries to get buy-in.
Yeah, so we will talk some of the barriers. I just want to say that the overall result of this project was that we did see very significant results, and nurses did start to engage in supporting patients quit. So I just want to make sure that it was all worth it, because we're going to talk about some of the obstacles, and we overcame some of these obstacles, the final goal was reached and we got to where we wanted to go, which was a significant improvement on how nurses interact with patients who smoke and how they got engaged in supporting quitting. One of the challenges we have was it was actually just getting IRB approval in all of these countries. In some of the countries, there has never been an IRB approval for a nursing-led project. So we had to work and why nurses are able to lead projects, and we had to create, and again, was very important that we had the support of our physician colleagues, particularly in the Czech Republic, like Linda mentioned. But it was, it was unique to us to have to mentor and help our partners and colleagues to navigate some of these difficulties. Another interesting is that we were using online education to reach the broadest possible number of nurses. And in some of these countries, they have never done online education for nursing. So we had to work with that. And when we tried to get continuing education credit, it was unique to have continuing education credit for a nursing led nursing target educational program. So these are some of the things that, it wasn't quite obstacles, but were challenges that we really had to work with our colleagues, and it required a time. And that was the other thing. We had an ever-moving timeline because everything took a bit longer than we thought it would take. Just the translation and back translation alone was something. Linda, do you want to mention something else?
Yes. One of the things I'd like to draw your attention to is the reason we showed the map was we wanted you to see that all of these countries had contiguous borders. And in addition, our strategy was to do train the trainer programs on the ground. So we actually did go and visit with nursing champions and at various locations. In some cases, we were able to meet with heads of nursing organizations, hospital directors, to talk about this innovative initiative. And it was relatively easy to travel. However, although these countries are all very close, they all have very different cultures and they have very different backgrounds and expectations for nursing education. So again, we were starting with, fortunately, a motivated group of nurses who really often firsthand experienced the devastation of tobacco-related death and misery and wanted to make a difference. So when we brought our program abroad, as Stella mentioned, we had to translate not just the language, but we also had to make certain it was culturally appropriate. And this issue about the independence of nurses at the bedside was a big one. And again, that's why we made it relatively simple. We also had to be very realistic about what were the resources available in each country so that we could promote using the local resources. But we were involved in making a cultural change. So when I began my career as an oncology nurse and I focused on lung cancer, I often talked about Hungary, that had the highest death rate of lung cancer in the world. It was very exciting now to be involved with the Hungarians, where their entire government was involved in increasing the tobacco control efforts. And each of the governments in these different countries also had a different approach. Stella?
Thank you, Linda. Yeah, I think the importance of the political context was something that it was in some ways unique to some of our nurse colleagues who might have been more used to just, most of them were doing bedside practice and not very paying that much attention to what happens at the higher level in the political sphere as far as their practice. And I think what we notice is that in countries that have decided to make a tobacco control a priority for the country, the nurses received a more enthusiastic support from administration in the hospitals they work, or the clinics or the health professionals. The other thing that was interesting is that because there was such diversity between countries, where some countries were very motivated at a country level to advance tobacco control, it really helped bring some of the nurses into more of the advocacy role, and nurses feeling that they should be a voice for their patients, and they should be a voice for public health, and they should be a voice for tobacco control. Where in the past, some of these nurses thought they were just really more providing the care, which is very important, but they really hadn't seen their role as a mover and shaker in the policy process. So we had the opportunity to see several of our nurse champions and nurses that we collaborated on TV programs and talking about quitting during World No Tobacco Day, or days like today, the American Great Smoke Out. We have nurses that went and presented testimony in Parliament to support the creation of smoke-free environments, because not all of these countries have legislation like we have here in California supporting smoke-free environments. So it was a very interesting evolution of the role of nurses that was not necessarily one intended at first, where we're really just trying to provide the education for this intervention, a very basic level intervention, because that's what we could do for nurses, or that nurses, scope of practice allowed. But it was very interesting to see how through the peer partnership, the network that was created, the nurses could support each other in more of this advocacy role for policies that would improve the health of not just their individual patients, but their communities at large. And that was very encouraging to see, and it continues. We understand that there is now European networks of nurses and tobacco control. There is continuing, that started with this core group of nurses that we mentioned before.
One thing I wanted to follow up with is to say the challenges of data collection became possible because of things like REDCap. So at UCLA, we translated all of our surveys. We used REDCap to send out automatic survey reminders so that we evaluated pre and post. We had a measurement tool that we focused on the delivery of tobacco dependence treatment in various details. And this was critical. As a result, we could have a big reach electronically. We did collect data on the ground too. We with our train the trainer workshops, we had pen and paper tests that were completed and then sent to us, and we analyzed. So from a scientific point of view, it was exciting to see that we could launch an ambitious multi-country collaborative and still collect data. We had to, again, train the people on the ground how to deliver the information. We had to make certain that we had IRB approved flyers about our study in every country. So it was very interesting. So, and my final comment I want to make before we open for questions is that one of the barriers for engaging nurses in tobacco control, frankly, any healthcare professional in tobacco control, is the individual's own smoking status. And you saw the statistics at the beginning of our presentation. And because this is a predominantly female profession in these countries, the nurses' brains weren't immune to addiction. They often mirrored the same patterns of smoking that other women in their country had. And this was challenging. So we had to head on look at supportive strategies to help them with their own quit efforts, but also let them know, regardless of their smoking status, they still had the obligation to intervene with helping other people quit. That just because they had had some relapses didn't mean that they wouldn't provide an intervention. So the smoking among healthcare professionals continues. We know from our studies in the United States that there was a time in the 70s that nurses had higher smoking prevalence than women in the general public, but now that's precipitously gone down. But in other countries in the world, it's still pretty high. So in conclusion to this part, I just hope that you're excited by what we were able to do with relatively limited funding, but with a great deal of passion, a great deal of commitment from nurses on the ground, often in challenging circumstances. And yes, the demand on work is a big one, but to really galvanize what we know about tobacco control around the world, to make it real for them and to make it real for how they could make a profound difference in their country, in their community, and in their patients' lives. So we'll open it for questions now.
Yes, thank you, Dean Sarna and Professor Bialis, for a wonderful presentation. I'm going to reveal my age and say I remember when cigarettes were sold in the gift shops in hospitals and they had cigarette vending machines there. So we've come a long way, thanks, in part to a lot of the work that you've done. For the participants, please, if you could put questions into the question and answer box. And I'm going to start with a question because I happen to know one of my doctoral students is in this presentation, is how do you get started? You mentioned in the US, you worked with the American Academy and AACN, but how did you make the connections internationally to be able to set up your program?
Well, I'm going to let Stella take this one because she has worked with the World Health Organization and tobacco control, and her alliances and relationships were pivotal. Stella?
Yeah, thank you. So, not everybody would have had the opportunity to come into this or similar initiatives, having worked in global tobacco control. But I think one of the ways that you can start making these connections is participating in scientific events, which eventually will come back, and start making these connections personally. It's very difficult to go into any country without having a solid partner at the country level. That it is fundamental that you have that partner. And the best way to develop that partnership is to reach out. And you'll be surprised, maybe because you read a paper from a professor or somebody in a country that is in a topic that interests you, email that person, reach out to that person. If you are at a conference in the days that we had conference or in a virtual conference, reach out to a person that you think can establish that connection. Say, I'm really interested in this research. What is happening in your country? Can we establish a partnership? So I think making the personal connections is the absolute first step. And then together is looking for funding after that. But there's no point in looking for funding without the personal partnership first.
It also had helped that in order to get funding, which we did get, was that we had published extensively on tobacco control based on our US studies, our policy efforts. We had conducted symposium, we had written books. So we were recognized as experts in the field. So that made a difference. But I have to tell you that our physician colleagues in particular were very, very important. Also colleagues in psychology who deal with addiction in the different countries were important. Respiratory therapists. One of the challenges that we probably should emphasize is spoken English. So the higher level educated, the physicians often had English language capabilities. We don't speak all these different languages, although Stella speaks many of them. But we did need to have some people on the ground who we could converse with. And so in each country, we had our nurse champions, but often they didn't speak English, but we had to have our champion who was a translator, who might have been a nurse, but sometimes was a physician or others.
So I wanted to do a follow-up question. You presented your program across a lot of different cultures. Did you find that certain strategies worked better in certain cultures than in other cultures?
So I'll start, Linda, and then you can go. We'll do this. So yes, and I think that part of why in the program work is that we spent a lot of time in the preparation and the development. Each program was customized to the country. So we didn't just, slap a program and translate it in 5 or 6 languages. We actually look at what was appropriate in each culture to talk about. So for example, there are a couple of countries where nurses could not talk about medication. And so we had to adjust. It was just not the role of nurses to talk to patients about medication. So we adapt to say nurses could talk to their doctors' colleagues. So I think that it's very important, and again, to have that context from the champions on the ground who will tell us and push back and say, this is not appropriate, this is appropriate. And so when we talk about translating, is not really just running this to a translating program, is actually having people reading the translated and then adjusting to what is appropriate to say, what is appropriate, not just content, but even how to say. And we even had to do that for all of our REDCap instruments, where we would translate and then somebody had to read it and reread it to make sure the questions are being asked in a way that was culturally relevant. So I think it's essential that you spend the time in the beginning to make sure everybody that is in the country thinks that is already, it is culturally appropriate before you start it, because otherwise people just will block it and you won't get, the receptivity that you expect. And so in some countries, we flat out start with talking about the issues of nurses who smoke and whether that could be a barrier. So we use the local data as well to adjust and adapt each one of the modules.
So I know we're running out of time, but I had one other question. We have about 2 minutes. What kind of nurse makes for a great champion for this kind of work?
Well, someone who is passionate, but someone also who understands the evidence and is willing to be educated. So we had some champions who hadn't had the type of education. We were very fortunate that in the Czech Republic in particular, they have nurse-led clinics to help people quit smoking. So some of these nurses had a heads up already. They knew they could do it. They had education, and they could demonstrate to the nurses in the other countries that this is possible. And this is, again, because nurses are the largest group of healthcare professional, boots on the ground. This was a way to absolutely expand the reach of healthcare professionals in helping people quit. So in conclusion, I think, Jan, right?
Yes.
I just want to thank everyone today for participating, for being part of this conversation of the wonderful journey we've had to communicate with some of the nurses who have been, again, some of them had this experience enhanced their lives they went on to get further education, and they became leaders in their own countries. This last slide is our website, tobaccofreenurses.org. It houses all of our projects, many of our presentations, our publications, our 2-decade history. So please, if you have more questions, we're happy to answer them. You can contact us, but I hope you go to the website to hear more. Thank you very much.
Thank you.